Hello, my friends. I'm Dr. Simone Carter, a urologist and men's health specialist with over 12 years of experience helping men protect not only their bodies but also their confidence, dignity, and relationships. Today, we're going to have one of the most honest and open conversations you'll find anywhere online, one that might even make you blush a little. It's a topic men often whisper about in private, search for late at night, or ask with hesitation in my clinic. But here, this is a safe and respectful space where we talk about intimacy, vitality, and men's health without shame. Because when we bring questions into the light, we don't just learn, we heal, we connect, and we realize we're never alone. Gentlemen, let me ask you something. Have you ever quietly wondered whether it's safe to swallow vaginal fluids during oral intimacy? What about the taste or the smell? Is it normal? Is it healthy? These are real questions, ones that affect confidence, closeness, and whether intimacy feels natural or uncomfortable. Yet, most men don't really know the science behind it. So today, I'm going to give you the full, evidence-based answer, medically, biologically, and emotionally, so that you and your partner can enjoy intimacy without fear or shame, but with deeper trust and understanding. Before we get into it, tell me in the comments, where are you watching from today? I love seeing men from all over the world learning and growing together in this community. And while you're here, don't forget to hit that like button and subscribe so you never miss new advice on men's health, vitality, and intimacy. Here's the first thing I want you to understand. Vaginal fluids are not dirty, toxic, or shameful. For healthy couples, they're generally safe. In fact, they're beautifully designed by the female body to protect delicate tissue, prevent infection, and make intimacy smoother and more pleasurable. But many men carry quiet fears, wondering if it's unsafe, if the taste means something's wrong, or if they should feel ashamed. The truth is, variation is normal, safety is achievable, and communication changes everything. Once you understand the biology, you'll see that what many consider taboo is actually the brilliance of nature at work. As a urologist who has worked with men for over a decade, I've seen how silent worries about intimacy can chip away at confidence and connection. I've spoken with men in their 40s rediscovering intimacy after divorce, men in their 60s and 70s finding new love, and long-term couples reigniting passion. And there's always a pattern. Once men understand what's normal, what isn't, and how to approach these moments with care and respect, shame fades and intimacy grows stronger. So let's talk about what many men misunderstand. One common misconception is that vaginal fluids are just moisture. That's not true. Vaginal lubrication is an incredible biological system. The Bartholin's glands release smooth fluid to reduce friction. The Skene's glands near the urethra add more lubrication, and sometimes female ejaculation, and the cervix contributes mucus that changes with hormonal cycles. This isn't random. It's the body preparing for safe, pleasurable connection. Another misconception is that taste or smell automatically means something is wrong. In reality, fluids vary naturally depending on hydration, diet, hormones, stress, and even medications. Pineapple, berries, and proper hydration can make fluids lighter and fresher, while garlic, alcohol, or coffee can make them stronger. Around ovulation, fluids tend to be more abundant and neutral, while near menstruation, they may have a faint metallic note. After menopause, they can be slightly more acidic or less plentiful. None of this is bad. It's simply individuality. The only real cause for concern is a sudden unpleasant change accompanied by itching, irritation, or unusual discharge, which usually points to an imbalance that's easy to treat. Now, about safety, yes, vaginal fluids are mostly made of water, amino acids, glucose, enzymes, and lactic acid. They're protective by nature, but just like semen or blood, they can also carry infections such as chlamydia, gonorrhea, herpes, or HIV. So while fluids are safe and healthy, infection-free couples, assuming they're always safe is a mistake. Health and trust go hand in hand, and talking about testing isn't unromantic. It's responsible and deeply respectful. One of the biggest barriers I see in men is fear of having the testing conversation. Many hesitate to ask, "Have you been tested?" Or, "Should we go together?" I once had a patient in his 60s who panicked after oral intimacy with a new partner because he had bleeding gums and feared HIV. The risk from oral activity is low, but not zero. When they both got tested, they discovered they were negative, and the process brought them closer than before. The lesson? Safety doesn't kill romance. It builds trust. The most harmful mistake, though, is responding with shame instead of kindness. If something tastes different or smells stronger and you respond with disgust or jokes, your partner feels rejected, and that shuts down intimacy fast. Instead, respond with care. Suggest a refreshing shower together, encourage hydration, and treat it as a shared experience. Acceptance is far more arousing than rejection. When a woman feels fully accepted, her arousal deepens, her trust expands, and intimacy becomes more profound for both of you. So, here's how to make intimacy both safe and fulfilling. Talk openly. Normalize these conversations. Get tested together at least twice a year. Maintain good hygiene, and stay compassionate. Treat any changes as something you face as a team, not as her problem. And remember, swallowing fluids is safe for healthy, infection-free couples. For many women, that act can even feel like a gesture of deep acceptance and connection. Gentlemen, listen carefully. You are never too old for passion. Desire doesn't retire, and trust doesn't expire. If you've carried quiet fears about this topic, let them go. If you've ever felt embarrassed to ask, know that thousands of men share the same questions. You are not strange, and you are not alone. When you approach intimacy with understanding, respect, and compassion, you don't just protect your health, you strengthen your bond. And that's what makes intimacy truly meaningful at any age. So, is it safe to swallow vaginal fluids? For healthy, infection-free couples, yes. Is variation normal? Absolutely. The real secret isn't biology. It's communication, trust, and respect. Gentlemen, if you found this conversation valuable, give this video a like so more men can find it. Subscribe to the channel. I release new men's health guidance every week. And don't forget to tell me in the comments where you're watching from. Remember this, age is not the end of vitality. Every wise choice you make, in health, in habits, and in how you treat your partner, brings more confidence, connection, and joy. I'm Dr. Simone Carter, reminding you that your health is your confidence is your connection, and passion truly has no expiration date. Take care, my friends, and I'll see you in the next video.